Hello everyone, welcome to another episode of Dental Tips of the Week with me, Dr. Shervin, in driver's seat from Artistic Dental Studio. Today we're going to talk about the continuation of the previous topic, which was toothache, and there are another three main sources that I need to talk about. First of all, I prefer to talk about a very common question that I was asked during the last week, and it is mainly about why the toothache is felt much more intense compared to the other types of pain, for example, on limbs or anywhere else in the body. I need to tell you about this because what happens normally is inflammation, and inflammation is characterized by an increase in blood flow to the area, to the affected area. And what normally happens in the cases of tooth inflammation is that the nerve and all the blood vessels into the tooth are normally surrounded by hard tissue. So there is no way this inflamed tissue could swell. This is why the pressure goes up so high that it produces excruciating pain compared to, for example, if a cut happens on a finger, it could easily swell to different directions. This is why toothache is very, very intense. And let's just talk about this. I wanted to tell you about different sources of pain. There are three main ones remaining. One of them, which is very common, is the one that normally deals with food getting jammed between the teeth. When there is not proper contact between the teeth, or the shapes of the teeth are not proper in any way, then food may get jammed between the teeth. And once this happens, the food actually gets packed between the gum and the tooth. It could produce some pain, which could vary between a slight discomfort to very intense kind of throbbing pain. So what needs to be done in these circumstances is that people normally try to remove the food debris by toothpick or with some tooth floss or something. And what normally happens is that they pack those food particles even further down. That's the problem. So what needs to be done in these cases is that you need to begin gargling your mouth with even plain water, preferably salty water, a pinch of salt in a glass of water. And then once you do that, you can make sure you can loosen the particles a bit, and after a while you can easily take these debris out by proper flossing or even brushing. So this kind of pain is normally characterized by eating. It happens after eating. So if such a thing happens to you, you may think, okay, there should be something going on with the food particles getting jammed between my teeth. The second type of pain, which is related to eating again and biting, is a crack in the tooth. Normally, when a crack happens, if someone bites on the tooth, the crack normally opens up. When you press on the tooth, it opens up, and when you open up, it just gets back to normal. And the pain is even more intense when you release the pressure. This kind of cracks could easily lead to sensitivity to cold and heat as well. So what needs to be done? It's really important. In these cases, you need to avoid biting or eating on that side. It's very important until you get to a dentist. Why? Because if you keep on biting, eating against that tooth, the crack has this propensity to propagate. It's just like a crack in a windshield of a car. It has this propensity to propagate, and it goes further down and down And if it goes further down the gum line, then there's no access to fix the tooth and you will lose the tooth. So it's very crucial to steer away from that side and also stay on a very soft diet until you can get to the dentist. The third type of pain, which is a kind of vague kind of pain, because it's very I would say it's very variable in terms of intensity, is a type of pain that is like coming from joints and muscles. Okay, it's very common in people with grinding, clenching, and things like that. They're normally stressed out, and it happens during stressful times like exam times for students. And what normally happens is that patient feels a bit tense when they wake up in the morning. They feel face is tired and they feel some tenderness around the joint and ear areas. So it normally comes from something like grinding and clenching. So what could be done? It's a multifactorial thing. So there's no single way to tackle it. What could be done is to first avoid stress if possible, get plenty of rest and hydration. The other thing you can do is to use hot compress over the affected area. You can use some type of painkillers with anti-inflammatory component in them, and also some muscle relaxants like diazepam. But you need to make sure there are no systemic interactions or any side effects coming from interactions between these medications and the medications you are already taking. And then what else you can do is that to stay on a very soft diet and to avoid opening your mouth very much, like during yawning, for example. You need to be very careful. Just take it easy on the joints until you can get to a dentist and get the proper treatment done. Thank you very much for your attention to this video, and please give us thumbs up and also put your comments down here. And you can even PM me if you have any questions, any concerns. I'm here to answer, and I will see you next week with the episode about tooth sensitivity. Thank you very much and enjoy the rest of your evening. Bye.